Hi, Dr. Jonathan Stegall here. A lot of patients ask me why I structure my treatments in the form of a program rather than simply as an a la carte option from which patients can pick and choose. There are a couple of key reasons why I love the program format. First, cancer is complicated, and as a result, treatments must be carefully chosen to address each of these key details. We know that each cancer is unique, and so is each patient. Each facet of the treatment protocol must work synergistically with the goal of being that the whole is greater than the sum of its parts. We also must make sure that we don't have treatments or therapies which conflict with other aspects of the program. The second reason why I love the treatment program format is that it removes the guesswork from my patients. Many of my patients come to me after having tried to manage every detail of their treatment plan themselves. This is true for patients who have been using conventional cancer treatments and sought to augment that with various natural and alternative therapies. And it's also true for those who focus solely on holistic therapies. In either case, most of these patients have become very stressed and overwhelmed, trying to figure out all of this for themselves. It's not worth the stress, especially since every patient deserves to have an expert take care of all of this for them. That's why I love to welcome new patients into my integrative cancer treatment program, where my team and I take care of the finer points of the protocol, including how everything is scheduled so that my patients can focus on what's really important, which is getting the treatment they need and healing from cancer. Now that we've established why we structure our treatments as a comprehensive program, I'd like to talk more about program length. Patients often ask, Dr. Stegall, why do you offer a 12-week program? Why not more? Why not less? And for some patients, 12 weeks seems like a long time, especially since you can go to other clinics and do a 3 or 4 week program. The reason for 12 weeks is that cancer probably took years to develop inside the body and was brewing long before symptoms ever started. It's unrealistic to think that a process which has been going on for years is going to be eradicated with just a few weeks of treatment. This is true for all stages of cancer, even early stage cancer. Remember, cancer is complicated. It takes a sophisticated treatment program to address it properly. Through a great deal of research, as well as trial and error, we've settled on a 12-week cancer treatment program. It's not too long, but it's not too short. What we've found is that it represents a great starting point for most people. It's important to remember that every patient is different, so it's impossible to guarantee a specific result or predict with any certainty whether or not 12 weeks will be enough. We've had patients with stage 4 cancer do our 12-week program and have no evidence of disease after completing it. That's awesome. But we've also had patients who made significant progress in those 12 weeks, but who still needed additional treatment. No one has a crystal ball, so if a clinic tells you with any sort of certainty that X number of weeks is all you'll need, look elsewhere, especially if they're only recommending a few weeks of treatment. You're doing yourself a huge disservice if you think that's going to be enough to get the kind of results you truly want. One final point, and I can't stress this enough. Your treatment plan must be integrative in its approach. And by this, I'm referring to including both conventional and alternative therapies in the protocol. While it sounds nice to be told that you're going to cure your cancer with IV vitamin C and good nutrition, that's simply not realistic. We need to use a variety of evidence-based therapies. After all, this is cancer we're talking about. Now, for those of you who are 100% against chemotherapy, I get it. It can be nasty. We've all seen people who receive standard of care chemotherapy, and they likely had some pretty bad side effects. Perhaps they even saw their cancer get worse. But this doesn't invalidate chemotherapy as a powerful anti-cancer tool. In fact, we have a lot of evidence that chemo works really well for a number of cancers. We need it, and thankfully we can give it in a safer and more humane fashion and still see a good treatment effect. In my office, we give chemotherapy in much lower doses than you'll see in other oncology offices. This allows us to safely give it more often. Patients love it because the side effect profile is far superior. And we love it as clinicians because it works. We augment our chemotherapy with some awesome complementary therapies, including hyperthermia, mistletoe, lymphatic therapy, key repurposed medications and supplements, and targeted nutritional strategies to have a really thorough impact. The result is a really in-depth cancer treatment program that's integrative, it's science-based, and it's tailored to each patient. If it sounds like what you're looking for, I look forward to connecting with you to learn more about your unique situation and discuss how I might be able to help.